and I always set this expectation. It is a necessary tool to eradicate Lyme, but it is not the end all to be all when someone has multiple things going on.
Right.
That practitioner has got to know timing, has got to know what to look for, has got to know what could activate post SOT. And that is then when you see it thriving and working really well. And I do think going back to these like online communities, you get in some of these SOT communities and it's a bunch of trash because the people are just being given it by these SOT clinics and not having the care around
Not
it.
managed correctly.
Yes, and it's not managed correctly. When it's managed correctly, it is the most wonderful tool at eradicating Lyme, but you
Right.
have to know what you're doing.
So it turns the Lyme off. It doesn't, there's still, after that happens, and we make sure that that's all good and hunky dunky, that there's the repair and restoration process
Yeah.
that has to happen next. And if you just do the first part and you don't address the repair and restoration, you can still feel like
Yes.
snot.
Because what we were talking about earlier is like when that spirochete, when it digs, it can literally cause physical damage to your cartilage, causing joint pain, causing inflammation. So yes, SOT will eradicate that bacteria and take it away, but it does not magically fix that damage that was done. And so that's also where you have to be very careful with talking to other people about this treatment, is if it's not managed properly with all the other things that go around it that we've said,
Yeah.
and you haven't then been put through a proper healing protocol post SOT, then you'll never have the quote positive benefit or success story that someone else might have that was given that opportunity from a practitioner. So